Hi, my name is Michelle Gross, and I'm a parent advocate. Today, I want to talk to you about my daughter Asher. She is a 7-year-old medically complex cutie. We use private duty nursing services in the state of Tennessee, and that has not always been an easy journey. When she first came home from a 2-month hospitalization that included 3 major surgeries, leaving her G-tube and tracheostomy dependent, we came home with services that were arranged by a discharge planner. My daughter requires 24-hour monitoring for her oxygen and receives all of her nutrition and medications through a feeding tube. The first home health agency we had were extremely difficult to work with. They were inconsistent with continuity of care, switching staff without warning when my daughter was inpatient for various procedures and surgeries her first year of life. We had several nurses sent to our home that were not properly trained in tracheostomy care or remotely familiar with the signs and symptoms to watch for with a post-open heart surgery patient. Reliability and dependability of staff were issues as well. When I spoke to the director of nursing, I was told I had to deal with the situation. I told her that I would work with our insurance company to find another option and was retorted, quote, "Good luck finding another provider, we're the only ones," unquote. I was overwhelmed with accepting that subpar was the only option for my daughter's care. I contacted another agency I found online and was informed of a barrier preventing access to care for my daughter was the lack of this agency's certificate of need for our county. Our insurance company did find another provider that could service our county. However, their administrative offices were in an adjacent county, making it exceedingly difficult to find staff that were willing to travel an hour to and from work. We did remain with that company for approximately 5 years, struggling with staffing issues, utilizing several less hours of authorized coverage due to the inability to fully staff our case. That reduction of nursing coverage for us meant less opportunity for me to work, which jeopardized my job and subsequently my daughter's primary insurance coverage. These struggles to gain access to sufficient care could be resolved if there were more provider options available throughout our state. Support for additional home health care options offering consistent, adequate, reliable home health nursing services to rural, medically complex pediatric patients would be cost-saving in that it would result in effective continuity of care, reduction in rehospitalizations, and elimination of nosocomial infection risk. Home-based care, whether provided by a parent, a caregiver, or a skilled nurse, fosters an environment of safety, freedom, independence, comfort, and recognition of surroundings. Thank you for your consideration in changing these laws in the state of Tennessee.